Interventions for challenging behavior of students with access needs of ASD. The integration of autistic students into general education settings poses unique challenges, particularly when addressing behavioral concerns. Research has shown that functional behavior assessment, or FBA, is an effective tool for identifying the functions of challenging behaviors and informing interventions. However, there remains a significant gap in the literature regarding the effectiveness of various interventions, especially in the context of general education. Systematic review findings, FBA, and positive behavior support, or PBS. The majority of studies highlight the effectiveness of FBA in developing positive behavior support plans tailored to individual students. For example, Tihan in 2024 demonstrates how an FBA-informed PBS plan can lead to marked reductions in challenging behaviors by focusing on proactive strategies and reinforcement techniques. Parent-mediated interventions. Mestari, Rivard, and Mello in 2024 explored the role of parents in implementing behavior support strategies, finding that parent-mediated interventions can significantly reduce challenging behaviors. This approach emphasizes collaboration between school personnel and families, ensuring consistency across home and school environments. Emotion regulation interventions. Nuska and colleagues in 2024 conducted a systematic review focusing on interventions targeting emotion dysregulation, a common precursor to challenging behaviors in autistic students. The review found that while many interventions are promising, there is a need for more comprehensive studies that include physiological measures of stress and emotion. Transition planning. Botemer, Boitel et al. 2024. Reviewed interventions for transition-age autistic youth, highlighting the importance of planning and support during key transitions, such as moving from primary to secondary education. The review calls for more research into interventions that address both academic and social-emotional needs during these transitions. Challenges in current research outcome measures. Many studies lack robust outcome measures, particularly those that assess long-term impacts on behavior and emotional well-being. This limits the generalizability of findings and the ability to draw definitive conclusions about the effectiveness of interventions. Nuska et al. 2024. Publishing bias. Single-case design studies, which are common in this field, may suffer from publishing bias. This can result in an overestimation of the effectiveness of certain interventions. Call et al. 2024. Diverse populations. The majority of studies focus on a narrow demographic of autistic students, often excluding those with co-occurring conditions or those from diverse cultural backgrounds. This limits the applicability of findings across the broader autistic population. Conclusion. While current research supports the use of FBA and related interventions for addressing challenging behaviors in autistic students, there is a clear need for more rigorous, transparent, and inclusive studies. Future research should focus on developing interventions that are effective across diverse populations and that address the full spectrum of emotional and behavioral challenges faced by autistic students in general education settings.